let's say your child had a brain injury and they received acute care and then rehabilitation care, and now you're home. Now what? And that's often a pretty tricky question that I get as a licensed pediatric psychologist that works a lot with brain injury. So things to keep an eye on and to monitor are going to be sleep problems, thinking and executive functioning, as well as emotion regulation. Those are the most common things we see from the psychological side following a brain injury. With regard to sleep, we often see things like difficulty falling asleep, difficulty staying asleep, daytime fatigue, regardless of how many hours you slept, lots of desire to nap, things like that. And the tricky part with that is that if you are already having side effects or symptoms from the brain injury, like headaches, irritability, of course, they'll be made worse by lack of sleep. With regard to executive functioning, the impact can be greater or smaller depending on where the brain injury was, but some things to keep an eye on is difficulties with planning, execution, initiation of tasks, things like following through on tasks. So even if your kid was super high achieving before the injury, and even if their IQ in general is still intact, you might notice a lot more difficulty with schoolwork and assignments. We would also expect some changes in mood. Sometimes that's just like really high highs, really low lows. Sometimes that's increased anxiety, increased irritability. Those are all things that a licensed psychologist can help with, but also something to keep an eye on that is quite normal. You might see an increase in tantrums, you might see an increase in kind of withdrawal behaviors, and that's going to be a good time to seek support for your child and maybe for yourself.